I'm Jennifer Smith.
And I'm Melva Jones.
And we are Women's Health in Black and White. And today we're going to talk about why your OB keeps sticking you with needles. I had a patient recently who said to me, "Are you going to take blood every visit?"
It does kind of feel that way.
It really
You're like,
does.
oh my God, I'm giving you urine, I'm giving you blood. Like, how much are you going to take? So
What
I
are you
understand.
doing with all this? Okay, so there are a lot of lab tests associated with pregnancy, and I'm just going to go over all of them with you. When you come in for your first visit, we are going to do a pap smear if you're due for one.
Right.
If you're not due for one, we're going to do a vaginal culture to test for things like yeast, bacterial vaginosis, trichomonas, gonorrhea, and chlamydia. Those things can affect the health of your pregnancy, and we need to know about them. We're going to do a urine culture. We're doing the urine culture because urinary tract infections can be asymptomatic in pregnancy and can cause miscarriages.
Yep.
So we test. And then we're going to draw a lot of blood, like tubes and tubes and tubes of blood. Which is why before you have your visit, I want you to have eaten a meal and had a whole bunch of water to drink.
Very well hydrated.
I don't want you to pass out when we draw your blood. And none of these have to be fasting.
Yeah.
So eat a meal and drink 3 big cups of water. So we are testing for hepatitis B, HIV, and syphilis. That's in addition to the vaginal culture we already took.
Yeah.
We are testing for your blood type. This is really important.
Really important.
I don't care as much about the ABO part of it.
Right.
You're either A, B, AB, or O. I don't care about that as much. I really care about the RH factor. RH is an antibody in your blood, and you can either be positive or negative.
Yeah.
Most people are positive. In fact, the most common blood type in the whole world is O positive. I'm A positive. Negative blood type, though, can cause a blood incompatibility issue between the baby's blood and mama's blood.
Right.
So let's say mama is O negative and daddy is A positive. Well, it's entirely possible that the baby is something positive, O or A positive. If that proves to be the case, there's always some mingling of mom and baby's blood. And at some point in the pregnancy, mom is going to get exposed to this A positive blood. And her body's going to say,
what is that?
This is foreign.
Yeah.
This is not me.
Right.
And begin to make antibodies against it. The first baby's usually fine.
Yeah.
The second baby can end in a miscarriage, or can result in a baby who's very, very, very sick and needs to have a complete blood transfusion at delivery.
Right.
Now, we will test your blood, and when you come back in for your next visit, we'll tell you what blood type you are. That way you'll have a heads up. If you happen to be something positive, when you get to that section of the book that talks about RH, you can skip it. It's not you.
Yeah.
If you are negative, and we know for a fact that the baby's daddy is also negative, like he has a blood donor card or he has his dog tags, I want proof, then you don't have to do anything. But if you are negative and daddy is positive or unknown, we're going to play a con job on your immune system. We're going to give you a shot of weakened antibodies called Rogaine. It floats around in your immune system. Your body says, ooh, I already have these. And it never builds the factory to make more of them.
Right.
That way, these antibodies that we've given you, they're going to die off in about 90 days. And so it's like starting from scratch. It gives your body a chance to avoid this immune response and leave this baby alone.
Yeah.
After delivery, we'll take a little bit of blood from your kid's umbilical cord and type it. If your baby is negative, like mama, you're done. If your baby is positive, you'll get another shot of those weakened antibodies.
Right.
We have known about this incompatibility for millennia.
Yeah.
It's in the medical literature as far back as the 600s. Some incredibly smart person in the 1950s or 60s figured out what it was and what to do about it.
Yeah.
And I am so happy that we can fix this for you. So you'll get that first shot of Rogaine about 28 weeks and the second one right after delivery. We're also going to test you for something called rubella. When you were a kid, you probably got a vaccine called an MMR.
Yes.
Measles, mumps, rubella. Rubella is also called German measles. The reason that we do this test is that German measles cause miscarriages and really bad birth defects. So if we know that you are immune to German measles, we take a deep breath and relax. If we know that you are non-immune, then my recommendation is don't go loving on strange people's kids. Avoid large crowds. It's not the time to go to Disney World. You don't want to get exposed to German measles if you're not immune. After delivery, we will give you another vaccine, and hopefully you'll be immune for the next baby.
Right.
Depending on your genetic background, you will also be tested for sickle cell anemia. Now, I've been arguing for years that we should test everybody for sickle cell anemia because while it is more typical for a black woman to have it than a white woman, I have taken care of white patients who have sickle cell anemia.
Yeah.
If you are a carrier of sickle cell or if you have the disease, then we definitely want to type the baby's daddy.
Yes.
If the baby's daddy does not carry it and it does not have it, then your baby will be well. When you are about 12 weeks pregnant, you'll be offered non-invasive genetic testing, non-invasive prenatal testing. This tests for the 3 most common trisomies. A trisomy means, okay, we're going to go way back to high school genetics, okay? We each have 46 chromosomes. When you are making your eggs, when your body made eggs, what it did was take those 46, line them up, and split them apart. 23 went in one egg, 23 went in another. When your husband made his sperm, the same thing happened.
Right.
They lined up those 46, split them apart, 23 went in one sperm, 23 in the other. So that when the sperm and the egg come together, you got 46 again. Sometimes those genes are sticky.
Yeah.
And they just don't
They don't
separate.
separate.
And so what you get is 24 from mom or 24 from dad and 23 from the other parent. And that results in a trisomy. You can have a trisomy anywhere along the genetic code. You can have a trisomy that is XXX. You can have a trisomy 5. You can have a trisomy 14. We don't test for those because they either result in a miscarriage or a trisomy XXX is a healthy baby who's just a little different. We'll talk about that in a much later video. We test for the 3 that result in live birth with severe birth defects. Trisomy 13, trisomy 18, and trisomy 21. Now, trisomy 13 is called a Tau's syndrome. I don't think I've ever heard anybody refer to it as that, but that's what it is.
Yeah.
Trisomy 18 is Edwards, but trisomy 21 is the one you guys know. That's Down syndrome. So this test takes mama's blood, and it takes fetal cells from mama's blood, spins them out and separates them, and gives us the likelihood that your baby has one of those 3 trisomies.
Right.
And it's a pretty good test.
It is.
It's like 98% accurate. As kind of a side effect of the test, it can also tell us if this is a little boy or a little girl.
Right.
We have a lot of people come in asking for the gender test. It is not the gender test.
Right.
In fact, from a medical standpoint, I just don't care if it's a boy or a girl. The only thing I care about is that this kid is normal and healthy. And frequently, well, not frequently, I don't want to say frequently, but sometimes the gender portion of it is not resulted for some reason or another. The company is very careful. They don't give us a gender unless they're absolutely sure.
Yeah.
So you get the test done, you're excited for the results, and we have to call you and say, I'm sorry, we didn't get gender back. Most people will get it, but every once in a while we get somebody who doesn't. There's another test on the market called the sneak peek. This is the gender test.
Right.
We don't offer it in my office because it's not a medically useful test. It tests only for gender.
For gender, yeah.
You can order them online. You can get them at places that do, for fun ultrasounds. Usually have them as well. I will say this though, before you spend your money on the sneak peek, I can think of 5 people that I know personally who were told one thing and got another. Sneak peek has proven to be very inaccurate in my experience. So if you're going to spend the money on the sneak peek and then invite 50 of your best friends to your gender reveal, don't yell at me when your ultrasound says something totally different.
I was just going to say, just wait for the 20-week ultrasound.
Okay, for real. There is a test at 16 weeks called the maternal quad screen. And part of that test, it's 4 chemicals. Part of that test is something called an AFP, alpha fetal protein. we are really not doing much of that maternal quad screen anymore at all.
Mm-hmm.
Because most of our patients are opting to do the test at 12 weeks.
Yeah.
Which means that we've already tested for Trisomy 13, 18, and 21.
Mm-hmm.
We are doing pretty much exclusively in my office only the AFP portion of it, which is spina bifida.
Yeah.
Because the first test doesn't test for spina bifida at all. Your insurance company may or may not pay for the non-invasive prenatal testing.
Mm-hmm.
Some do, some don't.
Yeah.
A lot of the companies have worked out kind of a deal where you can get that testing for $50 or $100,
Right.
whether or not your insurance will pay. The AFP portion of the maternal quad screen, though, is almost universally paid for by insurance.
Mm-hmm.
I've never run into an insurance company that wouldn't pay
Yeah.
for it. And then we're going to leave you alone for a while. So we drew your blood at your first visit. We offered you blood tests at 12 and 16 weeks.
Mm-hmm.
By the way, if you want the non-invasive prenatal testing, but you don't want to be stuck twice, you can do all of it at 16 weeks. That's a fine choice.
Yeah.
Then we're going to leave you alone. Your next blood test is at 28 weeks. At 28 weeks, we are testing you again for herpes. Not herpes, I lied. We are testing you for syphilis and HIV. We are doing that because syphilis and HIV have such a disastrous impact on the baby if we don't know about them. And the cases of syphilis are on the rise.
Oh, yeah.
HIV is not, thank the Lord, but syphilis is definitely increasing in new cases, especially in the area we live in.
Yeah.
We are also testing you for iron deficiency anemia. Most women by the beginning of their third trimester have become a little bit anemic.
Yeah.
And we are doing something called a glucose tolerance test. This is a test for something called gestational diabetes. Gestational diabetes can be disastrous for your baby. Untreated blood sugar means that the baby's blood sugar rises too.
Mm-hmm.
And your baby, the sugar in your blood crosses the placenta, your insulin doesn't.
Does not.
So even if we were to give you insulin, it wouldn't cross to the baby.
Mm-hmm.
So your body's pumping sugar into your baby, and your baby's pancreas has kicked up into high gear to deal with it.
Yeah.
And your baby is pumping out insulin as fast as it can. Then your baby is born. We clamp and cut the cord,
Mm-hmm.
and the supply of the sugar stops. And you know some babies aren't good eaters at first.
Right.
But the pancreas doesn't kick on to that,
Mm-hmm.
isn't aware of that
Yeah.
for several days.
Yeah. Still
So
pumping
you're-
out insulin.
The pancreas is still pumping out insulin as fast as it can. And what we have with a newborn born to a diabetic mama is very, very low blood sugars, dangerously low, that can cause seizures and even neonatal death. And if the diabetes is bad enough before birth, we can have something called intrauterine fetal death,
Right.
which means the baby is stillborn. So we want to know as early as we can whether or not you have diabetes so we can get those sugars under control as fast as possible. The way that we do a 1-hour glucose challenge is that we give you a specific amount of sugar,
Yeah.
50 grams, and we tell you to drink it 1 hour before we draw your blood. The timing is important here. So some offices make you come in, they
Mm-hmm.
have you drink the drink, and then they make you sit there for an hour. We don't do that. We trust our patients, and we don't want you to have to sit for an hour. So we give you the glucola at 24 weeks, take it home and tell you to drink it before your visit.
Mm-hmm.
But I need you to tell me what time you drank it. It's super important.
Right.
I also need you to get to the lab when it's time to have your blood drawn. So if you haven't been called back in yet, get up and go to the lab.
Yeah.
I want your blood drawn. The cutoff in our office is 140. Some offices use 145.
Mm-hmm.
We use 140. If you scored 139, you passed. If you scored 140, you failed.
Yeah.
The second test, the diagnostic test, is called the 3-hour glucose tolerance test. And it's miserable.
It's terrible.
It really is. First, we test your blood fasting. Then we give you 100 grams of glucola. And that is a lot of sugar. You're not going to feel good.
Yeah.
And then we test your blood at 1 hour, 2 hours, and 3 hours. If you fail 2 or more of those levels, you are a gestational diabetic, and then you get to start testing your blood 4 times a day.
Mm-hmm.
It is in your best interest to pass the first glucose test,
Right.
which means don't have Frosted Flakes for breakfast. Don't drink a big glass of tea on your way over. Don't.
Or
please.
orange juice.
Or orange juice.
Orange juice is terrible.
For the love of God, don't stop at Dairy Queen for a blizzard.
Mm-hmm.
I've had people do that.
Yeah.
You may eat, but eat protein. eggs, bacon, sausage, a salad with a protein in it, and a non-sweet dressing, and drink water.
Right.
And I've had people fail the test because they had a milkshake the night before.
Mm-hmm.
So be aware of the days leading up to it and try to limit your sugars.
Yeah.
If you pass the 1 hour, we are done with blood tests.
Yes.
You get nothing more until you are in labor, unless you start getting some elevated blood pressures.
Mm-hmm.
If you don't pass the 1 hour glucose, then you're up for the 3 hour and possibly testing your blood 4 times a day, every day for the rest of the pregnancy. Those are the tests that we do in pregnancy and why. Oh, I'm sorry. I forgot to mention there's one vaginal culture done at 36 weeks
Oh, yeah.
for a bacteria called Group B strep.
Mm-hmm.
Group B strep is one of the colonizers that lives in our gut, and we want you to have it.
Yeah.
We don't want it in the vagina at the moment your baby is born because your baby will go and get a lung full of it
Yeah.
and then get pneumonia. So that is done at 36 weeks.
Mm-hmm.
But after 28, if you pass that glucose,
Yeah.
we are no longer taking your blood.
Right.
Those are the tests that we do in pregnancy and why. If you have any questions about that or any other thing in women's healthcare or pregnancy or labor, let us know. Follow us on Facebook and Instagram,
And Twitter.
Twitter.
All our social media.
Yeah.
Like and share, subscribe. Let us know if there's any other topics you want us to
Absolutely.
discuss, because we do address those. And yeah, like Jennifer said, hopefully after that 28-week one, we won't have to bother you
Miss
anymore.
And we're going to cover in the next few episodes
Mm-hmm.
first trimester of pregnancy, second trimester of pregnancy, third trimester of pregnancy. Eventually we'll get around to labor and delivery. So if you are expecting or hope to be expecting soon, stick around. We're going to have some good information coming your way. Bye.
Bye.